hard with 2D pictures to do this. We're going to do the best we can. So we are looking at a 2D picture of a whole pelvis. So you're looking at this entire thing is the pelvis there. But we're going to specifically say these are coxal bones. This is a coxal bone. Hopefully you know that right there is the sacrum. So these are coxal bones. With the sacrum in between. So technically you're looking at pelvis. Or you could have the Latin, which is ox, say, whichever you prefer. Most of you are going to prefer coxal bone, right? All right, let's see so this bone up here, this top bone, where if I put my hands on it would be called the what? What's this bone? That is the ilium. It's I-L-I-U-M. That's the ilium. We're going to just label the bones right now. This bone, oh, it's hard to tell what I'm looking at. Okay. So this one's in the back, and it's actually talking in this back area here. What would this bone be? This is the back. One in the back. Which of the three bones is in the back? The ischium. It's the one that makes up your tush. Ischium is tush. Ischium. Let's see. This one in the front, this one is what this one's pointing at, is the pubis. I keep wanting to say pubic. Pubic is the adjective for what you say in between. Okay, so those are our three bones. So now we're going to go with some of the features, and we're not going to label all these lines that are on here. So this is pointing to the curve area. If I put my hands on it, this would be the iliac crest. This, where that sacrum is joining together, if I pull the sacrum out, you would see it's rough, is the sacroiliac joint. Sacral because it's the sacrum, iliac because it's the ilium. That's a C. Was that the only? Oh, no. We had, let's see if I can get it to label. I think I'm going to label it on the other one. Here, this little area here where your femur is going to connect in, so the socket part of the ball and socket is the acetabulum. 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 This one right here is pointing to the hole. So it's going to end with what? Foramen. So it's the obturator foramen. I'll have to practice these. Obturator foramen. That's an R. This is pointing to the little connector. What's the little connector called? Made out of fiber cartilage, but what is that little connector connecting the two coxal bones? Right there in between. The pubic symphysis. Mm-hmm. Pubic, because that's the adjective, symphysis. This is making an angle, so this is known as the pubic, I think I said it wrong, this is known as the pubic arch, is what it's called. Or it's called the subpubic angle, whichever you prefer. So pubic arch or subpubic angle. I think I've got pubic arch on your quiz. There. I have a couple things that I've got starred that aren't. Oh, this is pointing to the smoothness on the top. So you're looking at the smooth area on this bone at the top. Please don't label it smooth area, I'm just clarifying. Smooth area on top of the bone. Do you remember this is the pubic bone making up that pubic? So this is going to be called the, and it's on top. So this is the superior. Here, let me do this. Let me do that. Yeah. It is the superior ramus. I'm going to go ahead and put of the pubic bone because pubis, the way you can remember. Pubis is the one that makes the point at the front. Oh, what's this bone here? That's the sacrum. There are some lines going off. I didn't get them all off. We took some off the practical. And this little thing is supposed to be pointing at the area on the top. So that's what that's supposed to be, that little top rounded area. So that is the pelvic inlet. I think I got all of them on that one. We're not going to do those two. So, all right, on the other guy. So I got it turned around, so hopefully you can see that this is the back and this is the front. So we are looking at a posterior view here. This is a posterior view. Technically posterior side view, I guess. All right, so this bone up here is the ilium. So this rounded area, we're going to do features on this one, is the iliac crest, where you put your hands on your hip. We're not naming these two, so you can just put up. We took those off the practical. They have names. There's little spines, but that's okay. This is making this curve area here, because we're looking at the back, so we're not seeing the joint area. So this is where your sciatic nerve comes through. So this is the greater sciatic notch. Oh, goodness gracious. We're not going to do that one, so ignore that. So this little bump area here, we are on the ischium, because we're in the back here, that's where your tush is. And so this is the ischial spine, that little thing that's projecting off, ischial spine. If you learn to orient yourself, then it becomes a little bit easier. This one is pointing at the rough area, it's supposed to be. That rough area, so rough area we know is going to have, what is the second word? No, holes are foramens. Oh, no, ramuses are smooth, roughes are tuberosities. Yeah, tuberosities. Ramuses are usually a smoother area. So this is an ischial tuberosity. And if you have a bony butt, that little is what's rubbing against the muscle. This is just pointing to the bone itself, and I would actually tell you to name the bone itself. So the bone, what bone are we on in the back area here? This is the ischium. So again, learn the bones first. And this is pointing to the hole, and so this is that obturator foramen. This is pointing to the smooth area, so we're looking at the smooth area on the bottom here. So that's going to be a ramus, and it's on the bottom, so that is going to be the inferior ramus. Does that make sense? Inferior ramus. And it's of the pubis area. This is just pointing to bone. So what bone am I on here in the front that's making the point? Point is the pubis. And then this is the socket area, and that is that ACE tab U1, AC tab U1. And we're not doing that one. We're not doing either one of those little guys either. There are a lot more features. I took off a lot of them, and then we took off some more.